Hi, my name is Angela Sanford, and I'm an associate professor of internal medicine in the Division of Geriatric Medicine. And today I'd like to talk about the aging bias. I have no financial disclosures, and I will not discuss anything off-label or investigative. So today I hope we can explore the concept of ageism and how deeply rooted this bias is in each one of us. We'll compare and contrast the aging experience of the Western culture versus other cultures, and we'll talk about the impact of ageism in the healthcare setting, and then we'll think about ways in which we can change the ageism narrative within ourselves and within our surrounding culture. How many of you have ever experienced ageism? I took this picture, elderly parking only, when I was on a Girl Scout outing with my daughter. It's the first time I've ever seen a sign like this. And, nowadays we don't like the term or don't prefer the term elderly. Older adult is usually what we use. But I thought this was interesting and it made me think about how many people have experienced ageism. Have you ever thought, oh no, this 90-year-old man on my schedule is going to slow me down, or this 90-year-old that I'm working with, I guess also would be another thought. All these old people do is complain. That car in front of me is going so slow, it must be an old man. He shouldn't be driving. That elderly checker at Target takes so long to ring up our purchases. Let's go to the 20-year-old in checkout lane 3. OMG, is that old lady really using a check to pay at Walgreens? Why doesn't she get a debit card? Where are her kids to help her get with the technology? So, unfortunately, all of these thoughts have been my secret thoughts at one time or another. When I worked on writing this lecture, I realized how, preconceived these notions we have are, and my notions of ageism are just as bad as anyone else's, despite, me considering myself as a compassionate advocate for the older adult population. It's true that I always ask my kids to avoid this certain checker at Target because she takes so long. And it made me think that's really not the right way to go about it, and that's not right, the right way to teach my children. So my hope today is even just talking about this topic that you'll think in your head, ways that you can maybe change kind of the way you think yourself about aging and, the aging process. So everything you know about aging is wrong. From a young age, our developing brains are filled with images and stories and songs that really encourage fears of being old. If you think about our bedtime stories, usually the characters are older, they're ugly, they're scary, they're feeble. Um, and in elementary school, we celebrate the 100th day of school by dressing like humpback 100-year-olds. Anyone that's on Facebook always knows when around the time of the 100th day of school of all the elementary schools, because moms put pictures of their children looking like, older adults, and kind of making fun of the concept of being old. And we don't think anything of it. I never thought about it before, but it's probably not the best portrayal of older adults. Young women are the primary targets for anti-aging cosmetics, and there's this message in society that it's never too soon to fight the aging process. We don't always consider the beauty in the aging process. We want to stop it at all costs. We are conditioned to equate any amount of dependence as failure. And cultural messages present caregiving as a burden that leads to burnout instead of a natural or normal part of human relationships. Think about us raising children. We don't consider, that caregiving as a burden, or, we don't talk about caregiver burnout when we're raising our children, but we talk about it if we are helping our older adult relatives or older parents. So, why are old women often the face of evil in fairy tales and folklore? So, if you think about it, the one on the top left there, that's Snow White, the witch in Snow White. And she wants to poison Snow White with an apple. And then the lady next to her is the older woman in Hansel and Gretel. She catches children, cooks them in an oven, and eats them. And then in the top right is Cruella de Vil. She's an older woman who steals Dalmatian puppies from children. And then on the bottom left there, it's Ursula who rips out Ariel's voice box in The Little Mermaid so that she herself can have a youthful singing voice. And then on the far right there, it's the woman, the old witch in Rapunzel who locks up Rapunzel in a tower and uses the power of her hair to stay young forever. So in our fairy tales, we're teaching our children, that being old is scary and bad, and that old people are not good, essentially, by having these as our villains in our fairy tales. So, in terms of the prevalence of ageism, it's quite prevalent. This was a study that was done at the University of Michigan that looked at that used a 10 item everyday ageism scale to assess the exposure of ageism in over 2,000 older adults. And they found that 82% of older adults feel that they experience ageism every day. 65% reported exposure to ageist messages, such as ads, greeting cards, or commercials on a daily basis. And there was a high percentage that also experienced what we call internalized ageism, which is that they felt being sad or worried or lonely was just part of the aging process and was quote unquote normal for older adults. Ageism studies have been conducted all around the world, so ageism doesn't just occur in the US. It was actually observed in all 45 countries where the studies were conducted. There seems to be associations between ageism and health that are stronger in less developed countries, which is kind of surprising versus more developed countries. We always think of less developed countries as taking care of their elders more, but really in these countries, there's less resources for older adults versus developed countries where we have more resources available. And also, the association between ageism and health is stronger in those who are less educated. So I wanted to play this video. This is actually of my own children. So when I was working on writing this lecture and kind of looking everything up, I was talking to one of my colleagues about her perspective. She was 75, and I was asking her if she felt she had experienced ageism. And she told me that the new generation calls older people boomers. And I was thinking, I told her, I don't know that I ever heard my kids use that word. I would be surprised if they did. And it wasn't long after that conversation that I was trying to set up a new TV we had bought, and the TV was one of those smart TVs. It was definitely a lot smarter than me, and it was hard to get connected to the internet. And my kids they called me a boomer. So I sat them down and asked what that meant. I heard my children using the word boomer, and I inquired as to what this may be. All right, Blaze. Blaze is 12 years old. What is a boomer?
A boomer is someone who doesn't know anything about like the new culture, I guess. New culture, yeah.
All right, Cecilia is 11. What is a boomer?
A boomer is a person who's boring.
Sam is 9. What is a boomer?
Boomer is an old person who doesn't really know how to do anything.
Great. And their mom is a geriatrician. I was really horrified because I would like to think that I teach my children good things about the aging process and, I portray being older in a good light, but clearly it has not worn off, rubbed off on them as much as I had hoped. There seems to be a pervasive message in our society that younger is good and older is bad. But if you really think about it, being young or old aren't good or bad, they just are. There's different definitions of aging, and so there's a couple different models. We'll start with the biological aging model. So biological aging is basically what's someone's physiological age, what's the age of their cells. The other word for this is senescence. It's a process that leads to a gradual deterioration of function in cells and or organisms. So aging at the cellular level, if you break it down, as to what happens. You have telomere damage, epigenetic dysregulation, DNA damage, mitochondrial dysfunction, and this can cause stem cell exhaustion and chronic inflammation. So this particular model reflects how our body and brain show the physical effects of aging, and it's really a one-side view based on decline. Basically, as you age, you decline, your cells decline. And then there's the chronological aging model, which is basically based on your birthday. How old are you? And it leaves room for much heterogeneity, meaning, one 80-year-old is not going to be the same as another 80-year-old. I definitely take care of 65-year-olds in the nursing home who are much more debilitated and frail than 85-year-olds that I have in clinic who are playing pickleball. And the final aging model that we think of and that I like the best is the comprehensive person-centered aging model. So this is a model that looks at aging as a universal, lifelong, biological, psychological, social, and spiritual process of development. It's dynamic. It includes all processes, growth, loss, maintenance, and adaptation. It tends to be more multidimensional and multidirectional than the other models, and it's very individualized. I think the individualized part of aging is one of my favorite parts of my job. I can't really look at people who are of the same age the same way. I really have to look at the person behind the number. So ageism, what is ageism? It's a term that was coined first by Robert Butler in 1969. It's defined by the World Health Organization as a stereotype, prejudice, and or discrimination towards others or oneself based on age. So stereotypes, in general, are distorted or simplified beliefs that attribute characteristics to a member of a specific group. So it lumps people together without acknowledging their differences. So one example of an ageism stereotype is all older people are frail and helpless. Prejudices are judgments that are formed without sufficient knowledge, thoughts, or reason. They can be caused from stereotyping. But an example of an ageism prejudice is I can't hire this older candidate because older people aren't good with technology. And discrimination is an unjustified behavior towards different groups of people based on identity characteristics. So an example would be old people don't contribute to society and just drain our resources. So ageism can actually be directed at those who are young. We usually think about it in terms of being old, but people who are young can also be subjected to what we call reverse ageism. And in general, ageism tends to be an unconscious, unintentional thought process that's just ingrained in the way we think. The aging bias refers to a preference for or against a certain age group. And compared to other biases and other discriminations, it often goes unchallenged. I think we talk a lot about racism and sexism, but we often don't include ageism in these biases. So here's some examples of some other biases. Taller people are better leaders. We shouldn't hire that woman because she may become pregnant. That person in a wheelchair must also have cognitive deficits. Women are the weaker sex. Obese people are lazy. So I think we tend to think about some of our other biases more than we think about ageism and the aging bias. So one of the ways to combat ageism and combat these kind of ingrained thought processes are to look at people who we know who have successfully aged. So I kind of went through and found several people who are famous who are in their later decades of life, so 80s and 90s. So the top left there is Ruth Bader Ginsburg. She died at age 87. And then next to her is Larry King. He also died at age 87 and really worked up until his death. And then Betty White is next to Larry King. She died at an age 99. She hosted Saturday Night Live at age 88. Next to her is Warren Buffett. He's at 93 years old and still working to this very day. And then on the bottom right there, or sorry, the bottom left is B.B. King, and he still toured until his death at age 89. Next to him is John Williams. He was a famous composer of things like Jurassic Park and I think Star Wars he did. He had a career spanning 7 decades and died at age 92. And then next to him is Chuck Norris, and would you believe he's almost 85? And then Morgan Freeman is next to him, and he's old too. He's 86. So these are examples of people who have successfully aged, I think we could argue, and who are still, productive members of society and who have many accomplishments in their older years. So why do we care about ageism? Well, for one, it's bad for overall health and longevity. We know that people with positive attitudes tend to live longer. Positive attitudes on aging tend to live longer by an average of about 7.5 years. The stress of ageism causes increased risk of chronic disease, dementia, physical decline, and depression. People that have negative self-perceptions of aging, so these are beliefs that it's not important to seek medical care because they're old, or other beliefs that are just see the aging process as negative. These lead to poor self-related health. So those people think their health is worse, and it may be. And so we're trying to learn the associations between these negative self-thoughts about aging and what actually happens with the aging process in those people. Ageism also contributes to health inequity, both at the structural and individual level. So, at the structural level, societal institutions promote biases against older people through their policies and practices and procedures, and these lead to discrimination. So, example of this is most research studies exclude older adults. And then sometimes when people are older, they medical treatments and procedures are withheld from them just based on their age alone. I think we're trying to get around that practice in the medical world and really looking at, other aspects like how successfully is this person aging? Would they be able to tolerate the medical treatments and procedures and not just using age alone as a reason to withhold these? And then at the individual level, older people assimilate negative beliefs about aging from their culture. So it's kind of a vicious cycle. We kind of, form these beliefs from our culture and also feed our negative beliefs back into our culture and teach future generations. So ageism at the individual level can lead to poor quality of life, reduced longevity, and it can be a self-fulfilling prophecy. We sort of don't always know what comes first. Is it that people who have negative views on aging die earlier because they're chronically sick, or maybe their negativity plays a role in the response to their illness and thus it results in the reduction of lifespan. So why do beauty companies advertise anti-aging remedies instead of advertising the beauty of aging? I think it has to do with money a lot of the times. But think of the pervasive messages that these ads are sending to our children. As a mom, really, I have a preteen girl. She's telling me that she needs to wear sunscreen every day so that she can stop the aging process and never get wrinkles. Um, it's just very interesting how we keep this message alive and these ads don't help us, right? So, how do other cultures view aging? Let's start with the ancient Greek and Roman model on aging. So, they had this old is diseased model. Unfortunately, it was not very positive. Um, Old age was conceptualized as a downward slope of decrepitude and loss of the highly prized youth and vigor. Aristotle said that aging was due to a loss of innate heat. This heat is vital for the function of the soul and the body, and the flame diminishes with age. When the flame is extinguished, one dies. Galen, who was a Roman physician, felt that aging was a gradual loss of function and vitality through the extinction of the body's vital heat and humors, and is marked by increased desiccation. So, desiccation is kind of the drying out, or kind of, I think of it as like a withering up process. So, basically, you get old and you wither up. Um, Oops, let me go back. So on the bottom left here is Geras. He was the Greek god of old age. Geras is the Greek word for the word geriatrics. He was a lesser god who was granted immortality, but he wasn't ageless. So he would live forever, but he still aged. And as he aged, he became tinier and more shriveled. As he withered away, but didn't die, his lover, who was a more powerful Greek god, became disgusted with his appearance and basically turned him into a grasshopper because she didn't want to look at his old, withered, wrinkled body any longer. So many ancient cultures valued older adults, unlike the Greeks and Romans. Other cultures valued adults for their experience, their knowledge, and their survival skills. So think about in caveman times, older adults who were maybe 35, at that point, they knew water sources, they knew which plants were poisonous, and they really knew how to survive. In biblical times, long-lived people were regarded as favored by God to fulfill a divine purpose. Leviticus says, stand up in the presence of the aged, show respect for the elderly, and revere your God. Many key characters in the Bible were very old. Abraham, who's on the bottom left there, that's where he's sacrificing his son Isaac. He lived to 175 years old. In the middle is Adam from, Adam and Eve. He lived to be 930. And then Noah, with Noah in the ark, he lived to be 950 years old. Islam also had a positive view on aging. Honoring elders is part of Allah's glorification. Muhammad said, whenever one is in the presence of a senile in the tribe, respect him. To have people of old age will increase the mercy and the beneficence of God on him or her, and will expand one's blessings unto him or her. The Quran says, treat parents with benevolence. If either or both of them attain old age in your presence, then do not say even to them, nor reproach them, and always speak to both of them submissively. Eastern cultures also traditionally view older adults as wise, valuable members of the family and society. Elders tend to remain head of the family and are cared for by the extended family within the home. Shrines or altars are often created in homes where photos and mementos are placed of elderly relatives to promote honor. Aging is considered a natural process and should not be resisted. In Confucianism, there was a positive view of aging. Older adults were to be treated with respect and obedience. In Taoism, there's a belief that nothing in the universe, including us, will ever stay the same and that we must allow our life first force of energy to flow and transform as it may. And then in Buddhism, there's a belief that fragile bodies and minds are sacred and worthy of the greatest kindness and care. So, how did we get to be the way we are in the Western culture? Well, Western cultures have traditionally been thought of as ageist, and we tend to not value the older adult population as much as some of the other cultures. Our culture tends to be more youth-centered and places value on younger adults rather than older adults. Our culture is driven by Protestant values that tie individual work worth with the ability to work and to be an active member of society. So I think our culture started shifting. Well, it happened with the printing press development for one. When the printing press was developed, it made possible the rapid creation and distribution of written material. So elders in the past before that really had been considered to be living encyclopedias, or, they were the ones that sort of disseminated the knowledge within society. But once the printing press was developed, we could disseminate massive amounts of information, and we didn't need the older people to be our, sources of wisdom. And then the Industrial Revolution also greatly changed the way our culture viewed aging and older adults. Prior to the Industrial Revolution, we were an agricultural society where most people lived on farms. And who owned the farms? It was really wealthy older people. The older adults owned most of the land and therefore contributed most to the economy. When the Industrial Revolution came and factories were made, a lot of the younger people moved to the cities to work in the factories while the older people remained on the farms. But the younger people suddenly were the bigger contributors to the economy and sort of took over that role, which left the older people on the farms with a lesser role as perceived by society. Um, and so the people that were kind of left behind weren't as needed, and we needed all these young people to run all these new factories and this new technology. In our culture, aging is viewed as a deterioration, weakness, or disadvantage, and caregiving is viewed often as a burden. So, what's a social construct, and how is aging a social construct? Well, a social construct is a concept that is not really an objective reality, but it exists because humans have agreed upon it. So, social constructs are created to help us make sense of the world and to determine how we view others and their behaviors. So, for example, money. Money is really, if you think about what money is, it's just a piece of paper. But money has been assigned a value to us. So it's only valuable to us because we've all agreed upon, how much this money is worth, this piece of paper. Countries. So countries are just parcels of land that have been designated as having borders and belonging to a group of people. So we've sat down and said, this is where Canada is and this is where the US, and there's this imaginary line between it. So we constructed that. It's a construct. And then age. The definition of old and young has changed over time. So think about in caveman times, old was probably 35. And then in the Industrial Revolution, old was maybe 50. And then now people are living, easily to 75 or 85. And then also age, kind of the definition of old and young it changes across cultures. So old in sub-Saharan Africa where there's not enough nutrition and where, there's not vaccinations and we have increased diseases, old there is still quite young, maybe 30 or 40, versus old in Sardinia, which is an area in Italy where the oldest people live. They may live to be 105, so that, who knows, old might be 90 there. So aging is a social construct, and age, or what is old and what is young, is what we've agreed upon and how we define it as a society to be. So what are some of the positive aspects in the aging process? Um, there tends to be improved social and emotional intelligence as we age. There's a greater acceptance of self and others. There's less emotional volatility and better understanding of relationships. And our lived experiences as we age translate into wisdom. Older people tend to have more gratitude and resiliency. And older adults who hold positive perspectives on aging overall report less ageism and better physical and mental health. So just think about the older adults in advertising. All it takes is a walk down the greeting card aisle, and which does not paint the aging process in a very good light. So these are just some examples of greeting cards that you would not make you want to get older. So let's talk about ageism in healthcare. In the 1900s, the biomedical model of aging was created and taught into medical school and taught in medical schools. So this model focused on health as the absence of disease and disability, and the focus should be on curative solutions and maintenance of health. So disability, was equal to pathology or an impairment or a dysfunction. And this led to aging as something that needed to be diagnosed, treated, and cured, and sort of established the bias that aging is a pathological state, when really it doesn't have to be viewed as a pathological state. It is part of the life cycle. There's a high prevalence of ageism amongst healthcare professionals. Oftentimes, many have overall negative attitudes towards older adult patients. There's a desire of healthcare professionals to focus on curative medicine. There's also a desire to avoid the complexities of evaluating, diagnosing, and managing multiple comorbidities, which are common with age. There's a belief in healthcare providers that pain and suffering are just expected parts of old age, and a systemic focus on provider efficiency, productivity, and reimbursement. And all of us who work with older adults know it's not always the quickest patient population to serve. We often have to spend long amounts of time working through some of the challenging medical conditions and needs that older adults have. There is some evidence of slow cultural change. I think, especially in the hematology oncology world, there seems to be a push towards avoidance of age alone in dictating medical decision making. So we know age alone is not always a good indicator of health status or ability to recover. So I'm finding really in the cancer world that they're, discovering that more people who are older can tolerate some of these more invasive treatments for cancer, and that we can't say, just because this person is 80 years old, we shouldn't offer them life-saving cancer treatment, that maybe they really can tolerate it. So this was a study done that explored the attitudes of physicians in training towards older adult patients. They included interviews with 21 medical students and residents working in a teaching hospital in California. And I was just going to read a couple of these excerpts. So the healthcare worker in training says, it's always a bigger save when you help a 35-year-old woman with two kids than it is to bring an altered 89-year-old with a urinary tract infection back to her semi-altered state. So from that regard, it's a little bit less rewarding. Later in the interview, he states, it's hard to admit somebody fixed one of their 22 problems, probably their least significant problem, and then send them back. That's not rewarding. Maybe you rehydrate someone who's dehydrated, or you give them some anti-nausals since they're vomiting. You've made them feel better in the moment, but in the grand scheme of things, it doesn't feel like you've done much. So it's frustrating for me. This other healthcare provider in training says eventually you have to disengage and just leave the room, even if they have five other complaints they wanted to talk to you about, like the food wasn't good, the nurse kept waking them up in the middle of the night to take their blood pressure and they didn't like that, and they think their home medicine is a little bit different from this. In a diminutive voice, acting like he's the patient, they're the blue ones, a little bit bigger, and they're kind of shaped like this shape. In some, the intern says, I'd like to be able to talk to people all day, but when you have seven other people to see, you don't care if the little blue pill is this big or shaped like this or what. And then this fourth year medical student voiced similar frustrations by stating, doctors assume that when an old person comes in, there's going to be a ton of problems and it's going to be a pain to address all those issues. Responding to a question about whether she received negative messages from her colleagues about nursing home patients, she said, "Our gut reaction is when you hear that a patient is from a nursing home, you cringe a little. It's not that you're speaking negatively about them. It's just that generally they have a lot of medical problems and that's why they're in the nursing home. So while I can't guarantee that it doesn't affect their care, I'm hoping it doesn't. I'd like to think we give good care to everyone." So how do we change the narrative? There's no easy way, as a lot of these are deeply rooted in normalized beliefs in ourselves and in our culture. We must identify biases before they can be overcome. That's what I'm hoping maybe this lecture helped you with. I'm hoping you questioned yourself and sort of your thought processing on aging. We have to view others through the eyes of equity. We aim to treat everyone the same and respect all. We have to consider the contributions one made across a lifespan to their work, family, and community. I like to do this in the nursing home. Oftentimes, when I take care of patients there, they have significant memory impairment and they're not able to tell me, who they were or what they did. But I just have to imagine that they were once contributing members of society, probably very productive. They had, families they were raising, they accomplished things, they had a work life that they really enjoyed. And I just have to think about how they were and sort of look at their life, and not maybe necessarily exactly how they are now. In order also to change the narrative, we need to train the interdisciplinary healthcare team on how to identify ageism. And it's helpful when we can promote teams that are encompassing age diversity in the healthcare workplace setting so that people of different ages can work together and learn together. Biases tend to be challenged when people connect with each other on an authentic level and develop genuine relationships. We have to learn how to embrace the heterogeneous nature and complexity of aging and see beauty in this natural process. And then really just see our profession as one of service. And then I think we need to focus efforts on developing aging-friendly healthcare systems. So making sure that older adults receive the best comprehensive care possible with reduction of harm and with the promotion of satisfaction in the care that they receive. And changing the media's representation of older adults in the aging process is going to be huge in changing the message to our younger adults and our children. So just one last thing. This was a study that was done that included, meta-analysis concluded 63 studies with over 6,000 participants that looked at evidence-based strategies to reduce ageism. And they found interventions focusing on education and intergenerational context showed the largest effects on participant attitudes towards aging. The effects tended to be stronger for females and for adolescent or young adult age groups. And that is the end of my lecture. I'm thankful that you were able to listen, and I hope that this helped challenge some of the beliefs that you have.